Hello. My major role in, I think, this conference is to describe how we utilized in WellStar to put the information we obtained through the community in performing our community health needs assessment. To give a little background information, one of the key findings that we had, next slide please, from the community health assessment was the need for enhanced access to healthcare services for the low-income and uninsured individuals in Cobb County, particularly those that live in the disproportionate unmet health need communities. This is a huge population in Cobb County. It amounts to about 240,000 people, yet the only resources available for those folks is about safety net providers that cover about 5,000 people. So there's a huge gap. And WellStar meets most of that gap through seeing these folks in the emergency room with overutilization, as well as admissions to the hospital and for ambulatory sensitive conditions at a very steep cost, with a direct cost of greater than $100 million. So there's a reason for doing things better. And Cobb Access Health grew out of the Access to Health Services I-Team. And I chair that now an official incorporated entity and soon to be a 501c3 entity. But the primary goal is to improve health for these same individuals by capacity building, by increased care coordination and bringing partners to the table to collaborate to improve the care. Next slide, please. I think that all y'all know by now that the ACA requires that all hospitals operating under Section 501c3 of the IRS Code are required to do community health needs assessments. And this identifies the health needs of the population with input from the community as well as public health. This is from that, then you develop an implementation strategy using the resources not only within the hospital but also within the community, using resources and priorities. Next slide. This slide gives a depiction of the two elements that come together in a community health needs assessment and an implementation strategy, and that the community informs by identifying the health needs of the hospital, then builds upon the current capabilities and coalitions available to deliver better health at a lower cost, better care. Community benefit sits at the intersection of those two, and you can read the definition of community benefit down here as the promotion of health for a class person sufficiently large so the whole community benefits. Dealing with 242,000 people is a community that definitely can benefit. The process, I was very fortunate to have been on the MAP steering committee since the onset back in 2010, and was a member of the Cobb 2020 steering committee as well. And we got a jump start in doing our China by the very comprehensive, thorough evaluation that was afforded to us by the Cobb Douglas Public Health MAP process and the Cobb 2020's CTG funded process. And it served as the backbone for our WellStar China with the focus groups, the telephonic surveys, the key informant interviews, as well as the extensive demographic information. This would have cost us thousands, hundreds of thousands of dollars without the participation from Cobb Douglas and the CDC. After we obtained this information, we took it out to our WellStar serves 5-county area, 1,500 square miles, and 3 public health departments are in that area. So we utilized the information that we derived in Cobb County, took it to the other public health departments, had them verify the information, which they did, was applicable to their communities, as well as then give reference to key informants in their communities, which once again added to the process. In the end, we came up with a very comprehensive ability to give an analysis of the entire community. Next slide. And to determine the priority, we had so much information. There was a need of setting priority needs. And to do so, we looked through the lens of the IHI's triple aim. And once again, the better care, better health, lower cost, as well as the National Prevention Strategy, which provided alignment with the national federal strategies. And then we used the Healthy People 2020 to provide the benchmarking from a national database, as well as to provide us some long-term goals to incorporate into our implementation strategy. We wanted to use the health determinant benchmarking too, since so much is more than just access to care. It's the social and economic determinants of health, behavioral determinants of health. And we used the University of Wisconsin county health rankings and roadmaps. In addition, we were fortunate to have access to the Kaiser Permanente China data platform, which was immensely helpful to providing not only a process map of how you do this from probably the experts in how to do this, since they've been doing it for so long, but also doing the target area assessments, as well as the supplemental data that we needed to fill in the gaps, since there wasn't a lot of information from local sources to do some of this. The result is we had the high priority needs on the left, and those are primarily the things that can be dealt with in a patient-centered medical home that can be supported by a health system or supported by a hospital, and line up with, once again, the Healthy People 2020 and the chronic disease and healthy lifestyles and the need for improvement of mental health. The lower ones are those that a single entity cannot by themselves change without policy change and cultural changes. We found that in general, the medium were those things that we were doing pretty well in Cobb County. Maybe not necessarily the same in some of the outlying counties that we serve. Next slide, please. And so we came up with the process of developing our community benefit plan, and that was my job as well, to author our implementation strategy. And to derive this, we looked to the Catholic Health Association, which has been doing this since 1989, and they informed the ACA mandate as well as the IRS regulations in the Form 990 Section H. So it gave a good way to close the loop to derive our strategy, which met the rules and regulations. The first step, of course, was with a large institution like WellStar, was to look at all the sub-organizations within the organization that may be providing community benefit. Some was marketing, some community benefit, and distinguishing the two, and then having the opportunity to educate the people of WellStar, the culture of WellStar, about what is community benefit and how we can change things using the things that we're already doing with our community outreach programs and our corporate and community health and some of our health parks. Looking down the road to the second part was the phase 2, and that was to develop the community safety net organization, Cobb Access Health, which we talked about earlier, and of developing an accountable care organization. In that organization, that you bring people together that spans the full spectrum of all the health determinants, and not just those people who provide access to care. Only that way can you really touch the entire community and reach the goals that Healthy People 2020 want us to reach. It also brings together the medical care providers, public health, community stakeholders, and it helps to form the framework for a sustainable, integrated, coordinated system of care that emphasizes the shared responsibility of the health of the community and not just being put on the shoulders of the hospital system that is dominant in the community. In so doing, you can promote health, prevent disease, address the gaps, and in the long run, increase access to high-quality services that will lower the cost of care and improve the health of the community.